Hi guys, Dr. Dana here with Love Health Primary Care, where we offer holistic and affordable concierge medicine for all. It's late, it's like 10:30 at night, and I'm still at the office. Why? Because I'm fighting an insurance company on behalf of my patient, and I wanted to show you the hoops that we have to jump through just to provide basic care. So, just the other morning, a patient messaged me with severe, unexplainable neck pain. It was so concerning that I felt we needed an urgent CT scan of the arteries in her neck to rule out something serious like cervical artery dissection. Unfortunately, in an insurance based system, a situation like this always means a trip to the emergency room with long waits and a huge bill. But because of my local partnerships, I was able to get her a same day scan right here in town. Thank you to Wisteria Imaging and Wincoat, by the way. Now here's where the chaos begins. To get this simple test approved, I had to write a prescription with a specific CPT code. All right, let's ask ChatGPT. I'm just curious. How many CPT codes exist? So this is when you're coding for a specific study. There are over 11,000 CPT codes that currently exist. How many ICD-10 diagnoses exist? Okay, there are about 72,000 diagnosis codes. So these are the codes that we use to actually give a diagnosis, and the CPT code is a procedural code. So this is the script that I wrote. It contains, as you can see, the study that I ordered, the CTA neck with IV contrast, and I wrote it for a same-day CT scan. I put in the CPT code, which is the procedure code, and then I put in the ICD-10 code, which is the diagnosis code, and that represents cervical pain. And I also wrote, this patient has unexplainable severe bilateral neck pain with occipital pain. Please see attached PDF. Okay, so this is my attached PDF. It's actually a few pages long, and I specifically write in here, I'm requesting prior authorization. I specify the study, I specify her age range, I specify why she needs the study, the justification, I gave the clinical rationale, and I also gave the specific risk factors. I listed them all out, I listed the request again, and then I gave references. And yes, I used a HIPAA-compliant version of AI to help me with this, but it still took some time. Thankfully, I got the patient her scan, and the results were fine, but then I received this letter from the insurance company. They denied the claim, and they actually said the test was not medically necessary. So just an FYI, this was Independence Blue Cross. I think that we should be honest about who we're dealing with here. As you can see, they said your request was denied because your doctor is checking for a tear in the blood vessels in your neck. Dissection. Your doctor ordered a CT neck soft tissue. A CT is a way to take pictures of the inside of your body. It is not medically necessary, blah, blah, blah. There may be another test, such as a CTA of the neck, that may help you in your situation. And it's interesting because they cite the Carelon Medical Benefits Management Clinical Guideline as a reason why they denied this claim. They denied the claim, but they actually told me the exact test that would have been approved. This is the test that I had requested all along, and it turns out I had accidentally switched two numbers on the CPT code on the initial prescription, even though I wrote in the test that they were saying would have been approved. So here I am late night crafting a rebuttal, but what frustrates me most isn't the paperwork, actually. It's the lack of humanity. They stated that there was a doctor at the insurance company who reviewed my request. This doctor knew exactly what I was trying to do. They saw my diagnosis and they even mentioned my correct CPT code. And all they had to do was pick up the phone and call me. My number is all over the internet. Instead, they sent a denial letter putting bureaucracy over my patient's health. This is a system, unfortunately, that would rather waste everyone's time and money than show a moment of common sense. This is part of why I started Love Health Direct Primary Care. We don't have to deal with this. We don't have to deal with a middleman dictating care. You get a direct relationship with your doctor, and our follow-ups are at least 30 minutes long, not 4 to 5 patients an hour like the insurance-based system. This allows us to focus on what matters most, which is your health. And to that doctor who reviewed my letter, and to anyone in a position to deny care, please remember the humanity behind the paperwork. Your decisions affect real people. This patient is a mother, a wife, a sister. What if she was your family? This system isn't just about codes and claims, it's about seeing the human being in front of you. This is the care we all should be fighting for. In peace and health. This podcast is completely free. I started it to bring you truth and transparency about the things you deserve to know. If you found value here, the best way to support me is simple. Just give this video a like and hit the subscribe button. Your support helps me keep doing this important work and sharing it with more people. Thank you.